Okay, so we are going to go ahead and get started tonight. My name is Elizabeth Aloni, and I'm with Schneps Media. Schneps Media is the largest local media company in the New York metro area. We publish over 70 newspapers, magazines, webinars, websites, podcasts, and events throughout Queens, Manhattan, the Bronx, Brooklyn, Queens, Long Island, Westchester, and Philadelphia. Tonight, we'll have the opportunity to hear from the clinical leadership at NewYork-Presbyterian Brooklyn Methodist Hospital Cancer Center, who'll discuss the broad scope of expert cancer screening, diagnostic, and treatment options available. I'm thrilled to introduce our experts for tonight's discussion. Welcome first to Dr. Alan Astrow. Dr. Astrow is the Chief of Hematology and Medical Oncology at NewYork-Presbyterian Brooklyn Methodist Hospital and a professor of clinical medicine at Weill Cornell Medicine. Nationally recognized and board certified in medical oncology, hematology, and internal medicine, Dr. Astrow specializes in treating breast and gynecological cancers and in utilizing individualized therapies and targeted treatments for the medical management of cancer. Welcome, Dr. Astrow. Next, please welcome Dr. Vivian Bea. Dr. Bea is Section Chief of Breast Surgery at NewYork-Presbyterian Brooklyn Methodist Hospital Cancer Center and Assistant Professor of Surgery at Weill Cornell Medicine. Dr. Bea's areas of interest include breast cancer, benign breast disease, inflammatory breast disease, and high-risk management. Dr. Bea is committed to community outreach, research, and eliminating breast cancer disparities. Welcome, Dr. Bea. And finally, a warm welcome to Dr. Hani Ashamalla, Chief for Radiation Oncology. Dr. Ashamalla is the Chairman of Radiation Oncology at NewYork-Brooklyn Methodist Hospital and Clinical Professor at Weill Cornell Medicine. Dr. Ashamalla is named one of the top doctors by Castle Connolly Medical since 2001 and one of Best Doctors of New York Magazine since 2011. I'm so thrilled to have the clinical leadership of NewYork-Presbyterian Brooklyn Methodist Hospital Cancer Center with us here tonight. So let's jump in. Dr. Astrow, please, can you start us off with telling me about the varied areas of practice at NewYork-Presbyterian across all specialties and how that works and how it benefits patients? Or you just need to take yourself off mute.
Yes, I should be used to these Zooms by now, but yes.
Okay. Okay.
So NewYork-Presbyterian Brooklyn Methodist is a 650-bed full-service academic teaching hospital located in Park Slope, Brooklyn. We have the full spectrum of medical and surgical care at NYP Brooklyn Methodist. We have specialists in all the main areas that patients need. So we have top surgeons, top medical specialists, top experts in supportive areas such as radiology, pathology, so that when people come to NYP Brooklyn Methodist, they really can feel very comfortable that they're getting expert care. They're getting top-rated facilities, and they're getting the expertise that comes from Weill Cornell doctors and the quality that you get from NewYork-Presbyterian.
Thank you. That's very, very important. And the fact that it's all in one place, so you have all of these specialists.
Yes.
Doctor, can you walk us through kind of what a patient's experience would be with this type of setup?
Absolutely. So I'm going to talk about really a breast patient because that's who I see often, but I want the participants to keep in mind that at NewYork-Presbyterian Brooklyn Methodist, we treat all cancers. And so this is just sort of a surrogate example of what or how we treat patients. So say, women, we recommend that women who are 40 or over obtain a screening mammogram. And often that referral comes from their primary care physicians. And then they go and get the mammogram at a breast imaging location. And then for some women who've experienced this, there's a callback where we need to take additional views, and that's called a diagnostic mammogram. Oftentimes, the screening studies are an ultrasound for patients who have dense breasts in conjunction with the mammogram. And for the callback, if there's an abnormality, the next step is then a biopsy. And for those patients who are diagnosed with a breast cancer, our breast imagers, and that's the radiologist, will actually have the tissue evaluated by our pathologist, and then it's the cancer diagnosis, and then they refer the patients to our program. And the multidisciplinary care is really useful because for many cancers, and particularly for breast, it's not just one specialty that's important. It's really across a number of specialties. So surgery, and I'm a breast surgeon, medical oncology, Dr. Astrow is a medical oncologist, and radiation oncology, Dr. Hani Ashamalla is our radiation oncologist. And so the patient comes in and they come into our multidisciplinary practice, and they're able to see in real time all three physicians. And we sort of say the patient stays in one room and we come to the patient, and we really give them a tailored plan based on their cancer diagnosis. Now, I would be remiss if I don't or talk about our navigation system and our nurses, who are really a large part of our multidisciplinary program. And when I say multidisciplinary, that just means many specialty, many specialists, many team members. Our nurse navigators really help navigate those patients through the process. Many cannot imagine, and I will say it's unfortunate that some patients do go through cancer treatment without having a navigator who can assist. Imagine trying to sort of make all of those appointments: breast surgery, medical oncology, radiation oncology. And oftentimes we recommend, for those who need it, genetic testing, and so a genetic counselor. And so there's a lot that plays into it, and the navigators are really able to hold the patient's hand and walk them through the process. And so that's sort of a day in the life of a cancer patient who is diagnosed and referred to our program at NewYork-Presbyterian Brooklyn Methodist Hospital.
What a great sense of peace that must bring patients, to be able to know that everything's there in one place and everyone is working together, and you don't have to worry about all of that because there's so much else that you're focused on. You want to focus on your healing.
Right. And I should also mention that when the patient comes in, one of the many benefits is that we actually discuss the patient in our multidisciplinary, what we call a tumor board, where we review the patient's slides. That's the pathology slides that gives the diagnosis. And so we are reassured that that is the true diagnosis. We look at the breast imaging so that all of the specialists can see where the lesion is. And then we come up with a personalized treatment plan for the patient. And so it's not just generalized, it's really a comprehensive plan. And that plan is relayed to the patient oftentimes the same day that they see us. So they walk away knowing what they have and really what the next steps are for their treatment journey.
Wow. Dr. Astrow, did you want to add something?
Well, I would agree with what Dr. Bea said. Our aim is to take all the worry out of the experience of having to go to see the doctor, particularly for the experience of having cancer, and particularly with breast cancer, where you need so many specialists. So we look after the details for the patient. We do the worrying for the patient so that you can feel comfortable as a patient, or as a family member of a patient, or a friend of a patient, that you or your loved one are being cared for in the best possible way.
So very important during a difficult time. Thank you so much. Dr. Bea, we talked a little bit about the tumor board, and obviously I'd love for you to share more about the benefits of having this centralized location for all the diagnostic and treatment modalities. How does the patient benefit?
Yeah, I mean, I think Dr. Astrow sort of touched on it. They benefit because they're able to really have the diagnosis and then have a treatment plan. And it sort of goes, it's multifactorial, right? I mean, when you have just a blanket diagnosis, that's one thing. But when you really are able to come up with a plan as a treatment team, I can call my colleague, Dr. Astrow, and I can say, guidelines say this, and, what do you think? And sometimes it's not always sort of black or white. There's some wiggle room. And so in those cases, we're able to really discuss, what would benefit the patient. And so that's when I say the individualized treatment plan is so very important. And it's so important in cancer care across the spectrum. And so that is one of the many benefits of being treated in sort of, a centralized location. And then the patient doesn't have to go across the borough to see all of these different specialists. The specialists come to them, and really they're able to get it all done in one setting. And I should mention that process improves outcomes for many reasons. Because we're able to give the diagnosis and give the treatment plan, we can then get on to treatment. And the sooner you can get to treatment, the sooner you can sort of improve, the better you can improve outcomes. Imagine having to do all of those sort of visits across weeks and weeks. That delays your care. And so that's another important factor.
Yeah, I wonder if I can just expand on that just a little bit. I think you've hit the nail on the head. We have all, Dr. B, we have everyone in one room. From the patient's standpoint, what I think it's very important to know that all the doctors who are going to be involved in your care are there focusing on you and speaking to one another. I know that sometimes as a patient, you could be worried that the doctors aren't talking to one another. And so the information will be overlooked, or the doctors have to scramble to find the information, and they really won't be able to focus on you. Well, that's not the case here at our breast program at NYP Brooklyn Methodist, because all the doctors are there. They're all talking to one another. They have all the information about you that they need, and they're all working together to come up with the best possible plan for you. I will add another factor that's so crucial. We have a number of doctors in the same specialty who are discussing your case. So you have more than one surgeon there. So we get to share our knowledge, we get to share our experience. We have several medical oncologists, several radiation oncologists. We have people from Cornell coming in to participate in our conference. So everyone is there sharing knowledge and experience to come up with the best possible plan for you.
How incredibly critical. I mean, I can feel the hairs on my arm standing up thinking about that, about the intense care that that the best of the best doctors are working to help with you and working together to do that. Tremendous peace of mind. I can tell you, I'm not a scientist, but I can tell you from a peace of mind perspective how incredible that is.
Let me add one other thing, that the doctors are not competing with one another in this setting. They're all thinking about how we can all work together to take care of the patient. And the only focus there is what's best for the patient.
Yes, great point. Thank you so much. Now, I know another piece that's very important in cancer care is an infusion center. So Dr. Astrow, can you share with us what an infusion center is and why where it is matters? And then kind of walk us through how NewYork-Presbyterian Brooklyn Methodist Hospital Cancer Center is set up.
Okay, so an infusion center is a place where treatments which are given by vein, intravenously, are given. So it's very important that the infusion center be right near the place where the doctors see the patient, because that way the doctor can see you. And if you need to get a treatment, it could be a chemotherapy treatment, it could be an antibiotic, it could be a blood transfusion. Whatever that treatment is, the doctor can just send you right down the hall. You don't have to go across the street. You don't have to go to another building. It's right there for you. And if there's any problem, the doctor, or if you have a question, say you're getting a treatment, you have a question, the doctor can just walk right over across the hall and speak to you, or can look into the problem. So that's a tremendous advantage. And that's what we have now at NYP Brooklyn Methodist. What we also have there is we have our pharmacy right there. That's the pharmacies where the medications are stored and mixed. And you have your pharmacist there. So first of all, it saves time. You don't have to wait to have your medications delivered from somewhere else. But second, it's a key safety feature because the pharmacist is a key ally of the doctor and of the nurse in double checking triple checking to make sure that the right medication is being given at the right dose. So that's very, very important for the patient to help you relax, to know that you have many people who are looking into your care, looking into your treatment, and making sure that the right treatment is given. That's all right there. We also have a laboratory, again, right there, a very sophisticated lab where we have the latest blood counting machines, blood chemistry instruments, so we can get the results right away. So you're not waiting around an hour or two for a blood count to come back or for a blood chemistry result that's sometimes needed before your treatment starts. We have the machines right there, the results are obtained right away, and your treatment can start right away. So all those things are tremendous advantages for the patient.
Absolutely, I can see that. And what a wonderful way to be able to work.
I just want to add, if you don't mind, there's one thing that I think put us in above all the competitors, both in New York City as well as, of course, Brooklyn, that we are able to offer clinical trials, which is really the top of science. A lot of easy cancer patients can be treated anywhere. But when you have a difficult cancer, controversial case, a case that needs sometimes an edge of science, the best is to be enrolled in a clinical trials. And we are really privileged to have not only the clinical trial office of Brooklyn, but also the power of the enterprise of New York-Presbyterian, including Cornell and Columbia. And that gives all Brooklyn citizens, really, they don't have to go traveling or take their mom somewhere else. If they need a clinical trial, they can log in here, seen by one of us. And if we find that he or she, if there are different cancers, we have clinical trials for almost every single type of cancer we have in the body. And specifically for breast cancer, we have cancers, early cancers, we have late cancers, and all of them can be actually participate in these clinical trials and get the benefit of so many gurus of the field looking at almost at us while we are treating them.
That's such a great point. Thank you for bringing that up. And in fact, if you would be so kind as to expand further, because I know that New York-Presbyterian Brooklyn Methodist Hospital Cancer Center has an affiliation with Weill Cornell Medicine, and as you mentioned, the Joint Clinical Trials Office. So can you share a little bit more about that with us?
Thank you. Sure. So as you have heard, each one of us holds a faculty position at Cornell. Not only we are participating in multidisciplinary clinics, as Dr. Bea and Astrow have eloquently described, but also we have the ability to make our own experimental studies or participate in national studies. So we are in Brooklyn Methodist Hospital, we are the national base of a cooperative study called NRG, where we can enroll patients in phase 3 trials, which is really the top of the type of clinical studies. Phase 3 means that there are 2 types of treatments, and one is being tried against the other, and both of them are accepted by FDA. Both of them are really used, nothing experimental, but in the same time, we are offering to the patient maybe one of them in many years from now will be slightly better. On the same type of, we have also what we call phase 1 or 2, which are studies that are coming usually from Cornell, and we have the ability to use them here, offer them to the candidates of patients who are really good and eligible to be participating in these studies. It could be a surgical question, it could be a radiation question, it could be a chemotherapy or immune therapy question. A lot of this are being handled by a clinical trial office, very well manned, and they are very compassionate people. They know how to deal with patients who have cancer, exactly like the oncologists who are behind the wheel, if you may. Thirdly, there are also types of studies are pharmaceutical based. If there is a new agent that Dr. Astrow wants to try, and he will be, or one of his team, will offer it to the candidates of Brooklyn patients who may be interested.
Can I just expand on that just a little bit?
Yes.
I think Dr. Ashamalla really covered the waterfront there about clinical trials. I'd just like to add one other factor here, that Cornell Medical School, Weill Cornell, is one of the top medical schools in the country. I'll say it's one of the top medical schools in the world. And you have like the best doctors are affiliated with Weill Cornell. Now, as a patient, if you have any serious problem, you want to know that your doctor is a top doctor. And in general, top doctors like to work with other top doctors because I want to have, like, if I have a patient who needs surgery, I want to know that that the surgeon there is a great surgeon. If I want a patient, if I have a patient of mine who needs radiation, I want to know that my radiation oncologist there is top notch. And so because we're part of Cornell, we are part of a system of the best doctors. And so that you as a patient would benefit from that. And I would say, I've worked at other hospitals, I've worked with other fine doctors who I think very highly of, but I moved to NYP Brooklyn Methodist, Weill Cornell 5 years ago. And one of the reasons I joined this hospital is because of its reputation and because of the top doctors who are present at this institution.
That really speaks to what this affiliation means to patients and obviously how it affects patient care.
That's correct.
Is there anything more you can share about how it affects patient care? I mean, obviously, Dr. Ashamalla, you shared about the clinical trials. Maybe we can talk a little bit more about that.
Well, let me just mention, so we have our breast tumor board. So we have, I don't know, so we show the mammograms of our patients, and we have great, breast imagers, mammographers in NYP Brooklyn Methodist. But one of the senior breast imagers from Cornell, Dr. Arleo, she joins that conference. She's with our doctors. She's commenting. Now, sometimes our doctors pick up stuff that she hasn't seen because we have really good images there. But it's really great that we have such expertise that all can come to bear because we are part of an institution which has tremendous resources that can help, that can be brought together to help the patient.
And I'll just say my colleagues really touched on the collaboration quite nicely. We are so thankful for the support, the powerhouse that we have. And because of that, we're able to really offer our patients state-of-the-art, top-notch cancer care. And I think that's important. It's important to note that patients don't have to cross the bridge in order to receive that top-notch care. And so when we look at the collaboration with Cornell, as Dr. Astrow mentioned, we've got experts and we're really, a network, an enterprise. And so all of the resources that are there are in Brooklyn as well. And so our patients benefit greatly.
Thank you.
I see there's some people who can't hear.
If someone said that they cannot hear, check your sound on your computer. If you have a Mac, you can check the system preferences, go to sound and make sure it's not hit muted. You can also make it louder.
Yeah.
But someone else also said they wanted to know, you all are breast specialists, but one of our attendees was asking, what about prostate cancer?
So let me say something about that. Okay. So, and then I'll let Dr. Ashamalla weigh in because he happens to be an expert in the radiation of radiation therapy of prostate cancer. So yeah, prostate cancer is very, very common. And we have a great urologic oncology group at NYP Brooklyn Methodist. We have 5 or 6 urologists now, and several of them focus on prostate surgery. And within the radiation group, we have the latest technologies and techniques for focusing the radiation beam, shortening the course of radiation, and minimizing the toxicity. Within our group, the medical oncology group, that's my group, we subspecialize. So I'm doing just primarily seeing women with breast cancer with my colleague, Dr. Taiwu. But we have one doctor who is focusing just on prostate cancer. That's Dr. Peter Gregos. So he's got the latest information on prostate cancer treatment. So just, with cancer treatments, they change so quickly. You don't want to get a treatment as a patient that was given a year ago because the recommendations have changed in the past year. You want someone who is up to date with what has been discovered yesterday. You really want someone who's got the latest information, because we have that level of specialty expertise. We can offer that to the patient. Dr. Ashamalla, would you want to say anything about the surgery and the radiation oncology for prostate cancer at NYP Brooklyn Methodist?
Sure, thank you very much. So I have been in Brooklyn for 25 years, and I have been in Methodist all these years. But I can tell you the last 3 to 5 years are really, Methodists have changed completely to become a real pillar in cancer care. Not just breast, but actually almost every other cancer. And we have all the technology and the expertise, both in humans as well as in technology as far as imaging. So we start by MRI of the prostate. And once we, in a group setting, we agree that there is a need for a biopsy, we refer him to one of our excellent urologists.
I'll just say something. Who reads that MRI of the prostate? Is it someone who's just reading one MRI of the prostate every month or so?
Yeah, so the people who read the MRI of the prostate are different than who read the MRI of the breast, only because the technology have become so advanced that they can't cope, as Dr. Astrow mentioned, with one technology. So there are specialized radiologists who read the MRI of the prostate, and I think there is a question from George asking, do you guys treat prostate cancer? So the answer is simply yes, but not only we treat prostate cancer, we take you as a whole, George, because one of the things, although we are talking mainly about breast today, breast and prostate are cousins. Actually, in many times, we see families that the uncles and the father and the grandfather have prostate cancer, and then the granddaughter or the sister is coming with breast cancer. And that's where Dr. B was talking about genetic counseling. So the person who comes with prostate, or for that matter, breast, we try to see if there is anyone else who correlate with other cancers. Once we make the diagnosis and we understand if it's localized or not, hopefully it is confined to the prostate, which means early stage or stage 1 or 2. The treatment can be robotic assisted radical prostatectomy, which basically they don't open the skin up. They just, through 5 holes, they go and remove the prostate. And that's called robotic type of assisted type of surgery. The other types are the radiation types, which there are plenty of types, but the most specialized ones are called IMRT, or something related to the word cyberknife. If you heard it in the news, we call it SBRT, which is really 5 large fractions of radiation, which are very curative to cancer. As Dr. Astrow mentioned, sometimes we have to add hormone therapy. That's where the associates of us from medical oncology comes in. Not only that, we have also a group of people who would worry about physical and, more importantly, psychological health, whether it's breast or prostate. People who lose their breast, they need a psychologist, they need a social worker, they need somebody to help them to do a plastic surgery, as Dr. B will mention very soon. In prostate cancer, we also talk to them about erectile functions, sexual dysfunctions, and all the things that can happen due to the treatment or due to the cancer. So I could go an hour with this, but I'm just trying to tell you the word yes we treat carries a multi-spectrum of physicians, technologists, and care.
Yeah, and let me just add that, like with readings, just for one example, reading a prostate MRI, which is a very specialized thing. Well, there's an expert, a world expert at Cornell, who reads the prostate MRIs, and we send our MRIs of the prostate to this expert. So again, we get the expertise of Weill Cornell because we're system and we can share expertise with other hospitals in our system.
Thank you. Thank you. And thinking about the whole person is invaluable. I know that someone was asking about how they can get referrals. I am going to share all of our doctors' contact information as well as additional contact information for New York Presbyterian, Brooklyn Methodist. So please, you will receive that and you will be able to do so. But Dr. Ashamalla, I want to go back to you in terms of a patient who is facing radiation oncology treatment. What should a patient think about? And what does the breadth of a program and the ability to access trials mean to a patient going through it?
Yeah, thank you for that question. So I want to preface by saying a diagnosis of cancer, as mentioned by my colleagues, it can affect not just the patient, but the whole family. And in radiation oncology, in breast team, in medical oncology, and in many other oncology teams in Brooklyn Methodist, we are not just treating the patient, but we are thinking of the patient and the family and the children and everybody. So when a patient with breast cancer, for example, comes in, or for that matter, prostate cancer, they meet with the nurse, they meet with the physician, and usually more than one physician, because we are an academic program, so we are also teaching radiation oncology residents. So usually the attending and the resident are together. We review everything. We review all the images. We review the slides and the pathology and the biopsy. We review the surgery if the surgery is done. We review the symptoms. We examine the patient. We talk to the family. And then we start talking to the patient about if he or she needs types of radiation therapy. We have, as I said, a spectrum of technologies. A spectrum means we can treat a very tiny little lesion, for example, in the eye or in the brain, or we can treat a big volume like a breast, and the technology is drastically different. The mainstay of treatment today is how to deliver a very precise, effective type of radiation without hurting the patient, without hurting the organs in the areas in the vicinity, and without causing long-lasting side effects and maintaining a good quality of life. And today's machinery, and maybe Elizabeth can put one of the machines we have now, are state-of-the-art machine that really we are very proud to have. It has a very high precision. So this is one of my physicists sitting on the machine. The one before, this is the machine called the True Beam. And this machine rotates around you. And as you can see, the machine is completely open. So if you feel claustrophobic or you feel like you can't put anything like an MRI in front of you, that's not going to happen. So this machine rotates. This machine can precisely find the area we want to treat. And also there is built in a CAT scan within this machine. And the CAT scan can actually, before we give the treatment, can tell us exactly if we are treating the right area or there is any deviation. And if there's any deviation, of course, we correct it before we treat. If you can go to the slide before, I just want to introduce you. This is part of my team, not all my team, but I want to say exactly like Dr. B or Dr. Astrow, we are so proud of our team. It's not just doctors, nurses, technicians, physicians, residents, physicists, biologists, social workers, psychologists, dietitians, dosimetrists, technicians, if I didn't mention it. All of these people are the most compassionate people that if I have any family member, and my father was treated in this department many years ago for liver cancer that spread to the bones. And a lot of these people, some of them at least, were there at that time. So what I'm trying to say is, thank you for sharing the slides, that from a radiation point of view, we try to give you the safest, the most precise, and the least side effects. Regarding clinical trials, our machines have to be quality assured by many, many layers. New York City, New York State, then there is a higher group called IORC, which really looks at the precision of radiation in order for us to participate in a clinical trial. Thank you.
Thank you so much for that. That is incredible when you were listing all the individuals that you have as a part of the team. I mean, I think my smile got wider and wider and wider. It's really, really spectacular. Thank you. We do have a bunch of questions coming in. I promise we will get to those. I do want to ask Dr. B, though, about health disparities, because that's a real problem. How does New York-Presbyterian Brooklyn Methodist Hospital Cancer Center address these disparities? And how do they ensure that access to all Brooklynites?
Yeah, I think that is a great and thoughtful and also timely question. As we know, health disparities are a real thing. And it basically means that individuals are less likely to survive a cancer diagnosis due to many factors. And one of the things that we know is that access to care is sort of one of those factors. In breast, although this is just one example of disparities, but in breast, although Black women are slightly less likely to be diagnosed with breast cancer, they're 40% more likely to die from a diagnosis. And so it's important to improve access. And I will say New York Presbyterian has made us proud in taking a stand and saying we are going to address this head on. And some of the things that we have been able to do, even in the pandemic, is go and do community outreach and engagement. And so we have alliances with many faith-based organizations where we're able to do similar webinars and discuss breast cancer care and actually prostate care and colorectal care. We have systems in which we funnel patients into the hospital system so that all patients, regardless of zip code, have the same great quality that my colleagues and I have talked about. And so it's sort of, as I say, putting your money where your mouth is and addressing the disparities head on. Now, I also like to just take an opportunity to show our Center for Community Health. And this is a new building that recently opened, and here are some photos of it, and it's directly across the street from our main hospital. And if you can flip through, you'll see this is the Center for Community Health, and it was named appropriately because it's for the community. It's for all Brooklynites. If you would go down, I actually will show, as you can see, top-notch patient rooms so that patients can have sort of a great experience despite sometimes often a devastating diagnosis. And I want to go ahead and move down to our breast team picture, which sort of represents what we've been talking about, excellent care. We're very collegial, but we're also very diverse in many ways. And I think, that's important to point out because we represent the patients and community that we serve. And that's across the system in all specialties of cancer at New York-Presbyterian Brooklyn Methodist.
Thank you so much for that. You just touched upon COVID, but I just wanted to ask you in regards to COVID, because I know people are nervous or have been nervous. What do you want to say to those people who maybe have put off screenings and because of—
I'm glad you asked that. Yeah, it's a great question. We have to remember that just because COVID started doesn't mean the cancer stopped. Mm-hmm. And while, the beginning of April last year, we were in the peak within New York City. We were the epicenter for COVID-19. And a lot of screening recommendations were put on pause. The American College of Radiology said we have to halt breast imaging, for example. We were unable to do colonoscopies. But once we got out of the peak, those same societies came back and said, we don't want to miss the boat this year. Folks need to go get their screening. And so what I have done and what my colleagues have done is really address the fear. COVID is real as well. And so what we have done in New York-Presbyterian Brooklyn Methodist and our whole entire enterprise is really practice safe protocol. So, the equipment is wiped down. We've actually decreased the number of patients who are in a sitting area. And so we've spaced out the scheduling to decrease the risk of exposure. All faculty, all staff members are wearing the appropriate PPE and washing their hands. And so, we are practicing safe protocols. We encourage patients to go and get their screening mammogram. And I also should say, when I say our leadership is taking a stand, we recognize that people lost their jobs and insurance, or maybe they took a lot of time off because of COVID, and they can't take off to have some of these screening tools. And so at Brooklyn Methodist Hospital, we've extended hours. We've also extended hours and opened up time for women who are recognized in the community as needing additional help to get them funnel them into our breast imaging programs. And so, we're doing what we can, but part of it is education and encouraging. And I want to just sort of encourage you all to think about it. If you haven't gotten your mammogram, please go get it. It could save your life. You likely know women in your life. Go get the mammogram. Also, colonoscopies and your prostate screening are all still very important.
Very, very well said. Thank you so much for that. And Julie,
may I add just a comment about,
please.
Dr. B, actually, sometimes she doesn't speak much about herself, but I may have to. Dr. B is an amazing but very humble surgeon. So that's why she doesn't say the whole truth. Dr. B was working all through COVID time. Actually, regardless if there are surgeries or not, she was available. She was available for patients who may not have breast problem, but may have a COVID problem. And actually that applies to many of us who became primary care doctors when COVID happened in Brooklyn. Cancer did not stop, so she has to see all the patients. Some of them are so angry because they can't have surgery because New York City closed operating rooms. We were converting operating rooms into intensive care units. So she has to calm them down. She has to hold their hands. She has to make sure they will get chemotherapy by Dr. Astrow, one of his teams, or hormone therapy until the time comes. I think she and her team worked harder during the COVID, maybe not in surgery suites, but actually in the wards and outside.
Thank you for sharing that.
That's so kind, Dr. Ashamalla. And I will say, again, it speaks to just the collegiality within our department. Dr. Ashamalla, Dr. Astrow are just fantastic physicians, and we all pull together for our patients. And I think one of the things I really want to convey tonight is that we really are, a family. And when you become a part of our cancer program, you become a part of that family. We've sort of thrown out names of navigators and, genetic counselors and social workers and all of that. But they really are people who care, and they really make, our program as we all sort of bind together. So thank you, Dr. Ashamalla.
I'm getting teary-eyed. I have to say, meeting the three of you, I'm just blown, excuse me, I'm getting a little, meeting the three of you, I'm really blown away. Such, compassion and humor and lightness and along with your incredible expertise. These doctors, for everyone who's here, these are the top. And they are so caring and so passionate. Anyone who has to go through cancer is lucky to meet you and your colleagues. So, I want to ask each of you, obviously we've been talking a lot about what sets New-York-Presbyterian Brooklyn Methodist Hospital Cancer Center apart. But maybe there's something else that you want to share with us about what makes it unique, or perhaps maybe a patient story that speaks to what sets what New-York-Presbyterian Brooklyn Methodist apart. I want to start, maybe Dr. Astrow, can you start us off with that? Just take yourself off mute. There you go.
So what we have going that's, I think, really special is the way we really listen to our patients. We have the expertise, but as Dr. Ashamalla already said about Dr. B, we try to have humility with our patients, and we listen to them, and we try to work with our patients to craft treatments so that they work for them and for their lives. So I'll just give you an example now. we have a patient, I can't go into the because of privacy, but she needed to continue work, and she needed to, we have something called a DigniCap where you don't lose your hair. We have that available, but the representative who needs from the company who put the cap on couldn't get there this week, and the patient had to have the treatment this week. So one of our nurse practitioners, Jennifer Schiff, who was just named NYPBMH Nurse Practitioner of the Year, she learned how to put the cap on herself, and she did the treatment herself so that the patient could get the treatment today. And so the patient was thrilled, and that's what we do. We will go out of our way to listen to our patients and to schedule things and to work for them to accommodate the treatments so they get the right treatment so it works for their lives.
Wow, thank you for that. Dr. Ashamalla, can you share with us a patient story?
I'm going to share a story that Dr. Astrow partially, I think, may remember. This lady, actually, her picture is, I'm not sure if it's still, but it was almost on all the buses with New York Presbyterian. Of course, we took her permission to do that. But this is a very well-kept, very classy African-American 68-year-old or something lady who was so scared to have her breast cancer dealt with for several months. And she went to several institutions, very, very high-ranked institutions in the city. But the poor lady, she was so scared until, unfortunately, the cancer went to a very bad stage and come through the skin. And this classy woman doesn't want to smell and doesn't want to bleed in her underclothes and all of that. And I think she was coming to me as a second opinion or something. And I think I spent with her at least an hour and a half. And it was really very fungating. We call it fungating breast cancer. Dr. B actually meets these people more than us sometimes, because sometimes it can be a very difficult surgical problem. But to make the story short, this lady, after a lot of talking and a lot of hand holding and a lot of crying from both sides, she agreed to be admitted that day. A breast surgeon saw her, put her on IV antibiotics, and on Saturday, I think that was a Thursday, she had her mastectomy. And she was the most happy client I have had, who came in very depressed, very upset, very down, very withdrawn from her family, to a very ready to actually put her picture on the newspaper and the magazines, very proud of the care she received here. She met Dr. Astrow later on. She got chemotherapy. And I must say, she called her son and told them, listen, you kept telling me to go to Sloan. I will not go anywhere else.
That's a beautiful story. Thank you so much. Out of something dark, you created something light. Thank you. Dr. B?
Yeah, I mean, I have a ton of stories. Our patients are just so so wonderful, and you know, it's interesting because we see them at the very beginning of a diagnosis, you know, and it's sort of they're in this dark tunnel, and they trust us to make recommendations that will save their lives, and sort of understanding that process and holding their hands. It's rewarding when, and we get this quite often when patients come in and they say, you know, thank you so much for taking the time to speak with me. Thank you for explaining it, because I understand the way that you explained it. I understand what needs to be done as a next step. And because of that, I have great comfort. You know, during COVID, we've talked about COVID, and we're still not out of the red with COVID. We had patients who we did have to hold their hands, and we really did have to address the psychosocial aspects that now COVID has topped on top of a cancer diagnosis, or placed on top of a cancer diagnosis. And so so there are many patients who, you know, we can talk about all night, who are awesome, but I think the takeaway is that we are thankful that they have chosen us, and we take that very, very seriously. Because it is their life that you know is in our hands, and the recommendations that we make really do matter.
Wow, thank you so much. This has really been fantastic information, and you really shed light on a lot of important things, but not just for our heads, but also for our hearts, and for what New York Presbyterian Brooklyn Methodist Hospital Cancer Center can offer patients suffering from any type of cancer throughout their journey. So what I'd like to do is turn to some of our attendee questions, because we have some great questions, and I know the doctors were answering them as we go, but I'm going to repeat them so that everyone can get the value of the answers. Hester wanted to know, do you have a program to monitor breast cancer survivors?
Maybe I'll take that one. The answer is yes. And I already mentioned our nurse practitioner of the year, Jennifer Schiff. Well, she's in charge of that program. So yeah, we have an organized way to follow breast cancer survivors, and we try to attend to the needs of patients. We don't yet have a separate survivors clinic. That's in the works, but we do have we have a structure, and we have a program, and we're very focused on the needs of people who have completed their treatment for cancer and are now well, and we want to keep them well.
Terrific, thank you. Sandra wanted to know, when using an MRI as a diagnostic tool for breast cancer, what is done to minimize false positives?
So I'll address this. I actually have written on breast MRIs, and so Sandra brings up a great point, and one that I think we need to talk about more in the community. Breast MRIs, while they're sensitive, they're not very specific, and so what that means is that they can pick up a lot of different stuff that doesn't necessarily equate to a meaningful diagnosis. And it leads us down a trail where we have to biopsy those things because we can't tell otherwise. And so to answer Sandra's question, the way that I address MRIs and my team is that we are absolutely thoughtful about ordering MRIs. We don't just order it free will. It's really based on recommendations. It's based on the patient's clinical scenario. If they really need it, then we order it, and we explain to the patient exactly what I just talked about, that an MRI, it's sensitive, and so it can pick up things that we then have to go and biopsy. So that's how we deal with MRIs of the breast.
Thank you for that. Dr. Astrow, I know you wanted to answer this question. Tanya wanted to know about insurance, what types of insurance were accepted?
Yeah, so naturally, I think none of us here, none of the doctors, we're not insurance experts, but we sort of know what the hospital does. So NYP Brooklyn Methodist accepts a wide range of different insurances. So certainly Medicare, most Medicaid, most forms of Medicare managed care, although not every single one. So you'd have to check with us. Usually we can work with the patient to, if we don't take your insurance, we can try to figure out a way to get you to another policy, which we do. But we take a lot of commercial insurances, Emblem, Blue Cross, Blue Shield, Aetna. So we take the range: Medicare, Medicaid, commercials, Medicaid managed care, various managed care plans. We work with people to try to make sure they get the care they need.
Terrific, thanks so much. Barbara wanted to know, do you incorporate alternate herbal medicine in your regime?
Maybe I'll take that one first. So first, we work. So Cornell has what's it called? An integrated medicine program, and so we work with them. And I will just say myself, I believe that there are many herbs and other alternative substances, even though they have not been well scientifically validated. Partly because there's no one, there's no pharmaceutical company to pay for the studies. I think there are many natural substances that have value for the treatment of cancer. And usually they need to be given in addition to the treatments that we prescribe. So we work with our patients. That's what I'd say. And we consult with our colleagues from the integrated medicine program at Cornell. And this is a program that we are continuing to develop in NYP Brooklyn Methodist. But for those of you who take supplements and herbal therapies, as long as you take the accepted therapies as well, we'll certainly work with you and support you.
I just want to add one little thing about that. So we have a clinical trial for liver cancer, basically metastatic cancer from colon going to the liver, which is a high dose vitamin C. plus a radiation injection called Y90. This is a very, very top of the science type of clinical trial. And actually vitamin C was proven to show some efficacy in patients who have colon cancer going to the liver. So that's one example of using maybe holistic medications like vitamins. On the other hand, though, during the radiation, we usually ask our patients to refrain from taking vitamins because some of the vitamins, if they are not pure, if they have a lot of supplements and minerals and antioxidants, sometimes it stimulates the effect of radiation and causes more skin irritation. So normally we ask our ladies to stop using their vitamins and supplements for the 4 weeks of radiation or so.
That's good to know. And certainly it sounds like if you're under treatment, you should be speaking to anything that you're taking to your doctor.
Yes, we listen to our patients, and we like to know, we like to work with you. So it's important to tell the doctor what medications you're taking and what supplements you're taking. We're very interested in that.
Terrific. Thank you. Sandra wanted to know, do you have 3D mammograms?
Yes, we do, Sandra.
Terrific. Thank you. Peter asked, why is it so difficult to obtain PET scans to monitor the ongoing treatment and status of the patient's cancer? And I guess I should ask, is it, or do you find it difficult?
So I don't think it is difficult to get PET scan. Actually, it's a standard of care in many cancers. Sometimes we face some insurance authorization because, as you know, Peter, it's an expensive test. Not every cancer is approved to have a PET scan, like early breast cancer. I don't think there will be indications to do PET. But for example, a rectal cancer, a stomach cancer, a lung cancer, esophageal cancer, pancreatic cancer, lymphomas, all of this we routinely order PET scan, not only at presentation, at time of diagnosis, but we order it periodically to follow up the treatment effects. And we do have actually the best machine in New York City. I told that the type of machine we have at Brooklyn Methodist Hospital is really the state-of-the-art type of scanner. And the radiologists are reading are from Cornell University.
Yes, it's in our new CCH building. And the doctors in Manhattan, they're envious of us because we have a much better machine than they have in Manhattan.
How do you like that? Terrific. Terrific. Thank you. Martha wanted to know, is a CT scan with contrast safe for a 93-year-old woman with recurrent melanoma?
I can try this, and Dr. Astrow can correct me. So it's not the age as much as really the kidney functions. So sometimes the age is, as you said, 93. But if her kidney functions are okay and a CAT scan is warranted, of course, there has to be a reason, not just we want to do it. So for example, a patient 93 has melanoma and the doctor wants to know if she has lung lesions or not. So he has to order a CAT scan. Whether he needs a CT scan with contrast or not, that's up to that doctor. Personally, I would have ordered PET CT scan. And the PET CT does not affect the age and does not affect the kidney functions, and it will give the same answers.
Okay. Can I just add, we do not discriminate against people because of their age. I had a patient not long ago, she was 98, she came to see me with breast cancer. She said to me, doctor, can you just get me through to 100? So I said, I'll do the best I can. I was at her 100th birthday party. She says to me, how about 105?
I love it. That's fantastic. Wow, well, this has really been tremendous. I want to thank our doctors. I also want to respect everyone's time. Honestly, we could be here all night asking you questions, but I want to respect everyone's time. And thank you, Dr. Astrow, Dr. Ashamalla, Dr. Bea, for being here with us and educating us on the NewYork-Presbyterian Brooklyn Methodist Hospital Cancer Center and the incredible work that you're doing in helping patients. And I did, again, put in the chat ways for all of our attendees to be able to contact you afterwards and be able to ask general questions as well. I put a number there as well. And I wanted to let everyone know that New York Presbyterian is going to be emailing to all of our attendees a directory of cancer specialists and contact information. So if you want to reach a particular doctor with a specific specialty, you will have that in your email boxes. So please keep note for that. We, Schneps Media, will be sending you an email tomorrow, again with everyone's contact information. So in case you missed it now, you'll receive it there. Again, as I said, this was recorded and we'll send you a link to that too, so you can watch it again and share it. And I want to thank all of our attendees for spending some of this evening with us. And I wish...
Can I say one last thing? I just want to add, we have the world's best nurses at NYP Brooklyn Methodist. I just want to say that our infusion nurses, they are great. They are so excellent in what they do, now their skill and their compassion. So I just want to add that. Best nurses anywhere.
I mean, look at the passion. Look at the passion of these doctors. Really, it's been such an incredible experience to meet the three of you and to have you speak here. So thank you so very much. I wish you all to stay safe and stay healthy, and make sure that you get your screening. Don't let COVID hold you back. Make sure you get screened and see your doctors. Have a great evening, everybody.
Thank you.
Bye.